The heart is a vital organ responsible for pumping blood throughout the body, delivering oxygen and nutrients to tissues, and removing waste products. When the heart is weak, it struggles to perform these functions efficiently, leading to various health problems. Recognizing the signs of a weak heart early can be life-saving, and understanding the solutions can help manage or even reverse heart weakness. According to the World Health Organization, cardiovascular diseases, CVDs, are the leading cause of death globally, with an estimated 17.9 million people dying from CVDs in 2019, representing 32% of all global deaths. Signs of a weak heart. 1. Shortness of breath. Shortness of breath, particularly during physical activity or when lying flat, can indicate that the heart is not pumping efficiently, leading to fluid buildup in the lungs. Scientific basis. Pulmonary congestion due to left ventricular dysfunction results in difficulty breathing. Studies show that about 88% of heart failure patients experience dyspnea as a primary symptom. Numerical data. According to the American Heart Association, over 6.2 million adults in the United States have heart failure, many of whom experience shortness of breath as a key symptom. 2. Fatigue and weakness. Chronic fatigue and weakness can occur when the heart cannot pump enough blood to meet the body's needs, leading to reduced oxygen delivery to muscles. Scientific basis. Reduced cardiac output leads to decreased perfusion of tissues, causing fatigue. Research indicates that approximately 73% of heart failure patients report fatigue as a major symptom. Numerical data. A study published in the European Journal of Heart Failure found that fatigue and exercise intolerance affect nearly 70% of patients with chronic heart failure. 3. Swelling, edema. Swelling in the legs, ankles, feet, or abdomen can result from the heart's inability to pump blood effectively, causing fluid to accumulate in tissues. Scientific basis. Right-sided heart failure often leads to peripheral edema due to increased venous pressure. Edema is observed in nearly 70% of individuals with heart failure. Numerical data. The National Institutes of Health report that about 80% of patients with heart failure exhibit some form of edema. 4. Rapid or irregular heartbeat. Palpitations or a racing heart can signal that the heart is overcompensating for its weakened pumping ability. Scientific basis. Arrhythmias often occur due to structural heart disease or electrolyte imbalances. Studies show that atrial fibrillation is present in 30 to 40% of heart failure patients. Numerical data. The prevalence of atrial fibrillation increases with the severity of heart failure, affecting up to 50% of patients with advanced stages. 5. Persistent cough or wheezing. A chronic cough or wheezing, especially if producing white or pink blood-tinged mucus, may indicate fluid buildup in the lungs due to heart failure. Scientific basis. Pulmonary edema from left ventricular failure causes fluid accumulation in the alveoli. Around 60% of heart failure patients may experience chronic cough or wheezing. Numerical data. A report from the American College of Cardiology highlights that 40 to 60% of heart failure patients develop symptoms related to pulmonary congestion. 6. Increased need to urinate at night. Frequent urination at night, nocturia, can be a sign of heart failure as the kidneys try to eliminate excess fluid. Scientific basis. Redistribution of fluid when lying down increases renal perfusion, leading to increased urine production. Nocturia is reported in approximately 50% of heart failure patients. Numerical data. The prevalence of nocturia in heart failure patients ranges from 50% to 90%, significantly impacting their quality of life. 7. Lack of appetite and nausea. Reduced blood flow to the digestive system can cause digestive issues, leading to a loss of appetite and nausea. Scientific basis. Congestive hepatopathy and gut edema impair gastrointestinal function. About 45% of heart failure patients report gastrointestinal symptoms. Numerical data. A study in the Journal of the American College of Cardiology found that nearly 40% of heart failure patients experience gastrointestinal symptoms, including nausea and loss of appetite. 8. Chest pain or discomfort. Chest pain, particularly angina, can occur when the heart muscle does not get enough oxygen-rich blood. Scientific basis: coronary artery disease causes myocardial ischemia, resulting in angina. Approximately 25% of heart failure patients experience chest pain. Numerical data: the American Heart Association states that over 25% of individuals with heart failure also suffer from angina or chest pain. 9. Dizziness and lightheadedness. Feeling dizzy or lightheaded can be due to low blood pressure or poor circulation, indicating a weak heart. Scientific basis: reduced cardiac output leads to decreased cerebral perfusion, causing dizziness. Dizziness is reported in about 30% of heart failure patients. Numerical data: studies show that 30 to 40% of heart failure patients experience symptoms of dizziness or lightheadedness. Solutions for a weak heart. 1. Medications. Various medications can help manage heart failure and improve heart function. Types. ACE inhibitors lower blood pressure and reduce heart strain. Clinical trials show a 20 to 25% reduction in mortality among heart failure patients using ACE inhibitors. Beta blockers slow the heart rate and reduce blood pressure. Research indicates a 30 to 35% decrease in hospitalization rates for heart failure patients on beta blockers. Diuretics help eliminate excess fluid and reduce swelling. Diuretics significantly reduce symptoms of fluid retention in 60 to 70% of patients. Aldosterone antagonists prevent fluid retention and lower blood pressure. Studies show a 10 to 15% reduction in mortality with aldosterone antagonists in heart failure patients. Numerical data: according to the American Heart Association, the combination of these medications can improve survival rates by 35 to 50% in heart failure patients. 2. Lifestyle changes. Diet. Low-sodium diet reduces fluid retention and lowers blood pressure. Reducing sodium intake to less than 2,300 mg per day can significantly decrease blood pressure and heart strain. Heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins. The DASH diet has been shown to reduce blood pressure by up to 11 millimeters of mercury. Exercise. Regular physical activity improves cardiovascular health and strengthens the heart. Moderate intensity exercise, like brisk walking for 150 minutes a week, can reduce the risk of heart disease by 30%. Tailored exercise programs designed by healthcare providers based on individual capabilities. Cardiac rehabilitation programs improve survival rates by 20 to 25%. Smoking cessation. Smoking damages blood vessels and the heart, so quitting is crucial. Smoking cessation reduces the risk of coronary heart disease by 50% within 1 year. Weight management. Maintaining a healthy weight reduces the heart's workload. A 5 to 10% reduction in body weight can significantly lower blood pressure and cholesterol levels. 3. Medical procedures and surgeries. Angioplasty and stenting open narrowed or blocked arteries to improve blood flow. Angioplasty reduces the risk of heart attack by 30 to 50%. Coronary artery bypass surgery creates a new route for blood to reach heart tissue. This surgery can improve survival rates by up to 50% in patients with severe coronary artery disease. Heart valve repair or replacement addresses valve issues that can weaken the heart. Valve surgeries improve symptoms and survival rates in over 70% of patients. Implantable devices. Pacemakers help control abnormal heart rhythms. Pacemakers are effective in over 90% of patients with severe bradycardia. Implantable cardioverter defibrillators, ICDs, prevent sudden cardiac arrest. ICDs reduce mortality rates by 23 to 31% in patients with heart failure and reduced ejection fraction. 4. Cardiac rehabilitation. A structured program combining education, exercise, and counseling to improve heart health. Benefits: enhances physical fitness, reduces symptoms, and improves overall quality of life. Participation in cardiac rehabilitation reduces the risk of subsequent cardiac events by 25 to 30%. Numerical data: studies indicate that cardiac rehabilitation can lower the risk of hospital readmission by 20 to 25% and improve quality of life scores by 15 to 20%. 5. Monitoring and regular checkups. Continuous monitoring and regular checkups with a healthcare provider are essential for managing heart health. Methods. Echocardiograms assess heart function and structure. Regular echocardiograms can detect changes in heart function early, allowing timely intervention. Electrocardiograms, ECGs, monitor heart rhythm and detect abnormalities. ECGs are crucial for diagnosing arrhythmias, which affect up to 50% of heart failure patients. Blood tests measure biomarkers like BNP, B-type natriuretic peptide, that indicate heart failure. Elevated BNP levels are seen in over 90% of heart failure patients. 6. Alternative therapies. Mind-body techniques. Practices like yoga and meditation can reduce stress and improve heart health. Studies show that regular yoga practice can lower blood pressure by 5 to 7 millimeters of mercury. Nutritional supplements. Omega-3 fatty acids, coenzyme Q10, and magnesium can support heart function. Omega-3 supplements can reduce triglyceride levels by 20 to 30%. Herbal remedies. Some herbs like hawthorn have been traditionally used to support heart health, but consultation with a healthcare provider is essential. Hawthorn has been shown to improve heart function in heart failure patients by 10 to 15%. Preventive measures. 1. Healthy diet. Explanation. A balanced diet low in saturated fats, trans fats, cholesterol, salt, and added sugars supports heart health. Components. Emphasis on fruits, vegetables, whole grains, lean proteins, and healthy fats like those from fish, nuts, and olive oil. Adhering to a Mediterranean diet can reduce the risk of heart disease by 30%. 2. Regular exercise. Regular physical activity strengthens the heart, improves circulation, and helps maintain a healthy weight. Types. Aerobic exercises, walking, jogging, swimming, strength training, and flexibility exercises. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic exercise per week. 3. Regular health screenings. Routine checkups and screenings help detect risk factors and early signs of heart disease. Screenings. Blood pressure checks, cholesterol levels, blood glucose levels, and body mass index, BMI. Regular screenings can detect conditions like hypertension and diabetes early, which are major risk factors for heart disease. 4. Stress management. Chronic stress can harm heart health, so managing stress through relaxation techniques is vital. Techniques. Deep breathing exercises, mindfulness, and hobbies that promote relaxation. Stress management programs can reduce the risk of cardiovascular events by 20 to 30%. 5. Avoiding smoking and excessive alcohol. Smoking and excessive alcohol consumption are major risk factors for heart disease. Action. Avoid smoking and limit alcohol intake to maintain heart health. Limiting alcohol to moderate levels can reduce the risk of heart disease by 20 to 40%. Conclusion. Recognizing the signs of a weak heart and implementing solutions is essential for maintaining cardiovascular health and preventing serious complications. By combining medical treatments, lifestyle changes, preventive measures, and regular monitoring, individuals can effectively manage heart weakness and improve their quality of life. Early intervention and a proactive approach to heart health are key to living a longer, healthier life. With cardiovascular diseases being the leading cause of death globally, understanding and addressing the signs of a weak heart can have a significant impact on public health.